1199 as we know it today was started by a group of professional pharmacists, all Jewish. Leon Davis and those very brave pharmacists were beginning to organize. While we celebrate Leon Davis, it is just as appropriate to celebrate Dr. Martin Cherkassky, because 50 years ago it took two parties to get a contract.
I had been the head of the institution for 7 years when that fateful day that Leon came knocking on our door. Lee and I, in classic American terms, were cut out to be enemies, the manager and the labor leader, but we became fast friends.
Dr. Cherkassky clearly was different than the other CEOs at the time. The idea and the concept that working people deserve to have decent conditions and decent benefits was not something that offended him, was not something that he was unalterably opposed to.
The story was that Leon Davis used to play pinochle with the president of the hospital. It is reputed that what Leon Davis said to him one day was, "You know, you have workers who are working here full-time and are also on public assistance, and you are a doctor of social medicine. I think you need to accept the union to be the representative for the workers."
So in 1959, he allowed an election here at Montefiore. There were about 900 eligible employees, and 2/3 voted for 1199. And Martin knew, if he recognized the union, that it would be the beginning of a movement that would spread across the city.
In 1989, we elected Dennis as president. Dennis was the first president to take us to church, or actually to require us to go to church. Dennis developed this relationship with Cardinal O'Connor, and he explained to Cardinal O'Connor what the conditions were in the institutions.
Every 1199 member does a job that is critical to health care, and so you should be paid accordingly.
It was the Cardinal that negotiated with our union a contract, by the way, that we haven't even come close to anymore.
I am very happy to report to you today that we have reached an agreement, a contract, a full final contract with the 4 Catholic hospitals and with St. Barnabas Hospital in the Bronx.
We adapted a saying to do the right thing. And we took that phrase, do the right thing, and then at the bottom we would say, like the Catholics. It was really what set the pattern for us to then go out to the League of Voluntary Hospitals and to say that the Catholic institutions are willing to do this. The workers in the League of Voluntary Hospitals deserve the same thing.
R-E-S-P-E-C-T, find out what it means to me. R-E-S-P-E-C-T, take out T-C-T.
I watched 1199 grow from almost obscurity in politics to a force that every politician in town wants them to be with them.
What I learned through becoming a union delegate and a union organizer really helped me shape what kind of elected official I wanted to be.
At this moment, I feel so incredibly proud that the work of all of us and our members, that we have more than 55% of our members, almost 6 of every 10 members who work for our union, who give anywhere from $5 to $10 a month for political action. And not only that, but with that money, we set the example not only in New York State by having the biggest political action fund in the state, but set the example to others in the country.
Because of our members, because of our values, because of what Leon Davis taught us and Dennis continued and George now brings even more, is that we can change this country. that SEIU can pass healthcare reform, that Dennis Rivera can go to the White House with the President of the United States and lead the entire business community about change, that Patrick Gaspard is in the White House.
In 1997, we founded our union as Unite for Dignity, a joint organizing project of SEIU, Unite, and the AFL-CIO.
Back then, Florida industry ranked among the worst in the nation for infections, bed sore, wages, and staffing levels.
13 years ago in Florida, there were 25 union nursing homes and 2 union hospitals. Today, 16,000 healthcare workers in the Right to Work South have a union. We are the largest healthcare union in the South, with 75 nursing homes and 10 hospitals in 17 counties across Florida.
Together we transform lives, making big improvements for Florida nursing homes, hospital, healthcare workers, and community.
Since we founded our union, Florida nursing home staffing standards have risen from one of the lowest to the highest at 2.9 hours per patient per day.
We've helped win hundreds of healthcare workers' jobs back after unjust firings. We won access to sick days and vacation days.
We have improved the wages and benefits for thousands of healthcare workers. Our members made history by winning the first pension plans for nursing home caregivers in Florida.
As caregivers, we have the right to stand up for our patients and residents because we are protected by the union contract.
Our work sites are safer, fair, and we have won job security, respect, and dignity.
Even the Florida Agency for Healthcare Administration, or AHCA, agrees.
Quality of care has substantially improved in Florida nursing homes since the introduction of safe staffing levels and other quality standards since 2001.
We worked with Congressman Kendrick Meek in 2002 to reduce class size in Florida schools. As a result, class sizes has been drastically reduced.
We have raised the minimum wages in Florida thanks to our support with mobilization effort.
Working people in Florida are able to vote early because SEIU members were in the front lines to pass the early voting law.
We have rose to the occasion, dreamt the impossible. We have won against some of the nation's largest for-profit companies to bring more hospitals and nursing home workers into our union.
We stood together to defend our civil rights. We have stood side by side for immigrant rights. We've come a long way.
And we have a lot more to accomplish.
Now that we have joined forces with 1199 SEIU, we can dream bigger dreams, build power, enhance patient advocacy, expand our political voices, and unite thousands of Florida healthcare workers.
My name is Frank Janung, and I work at St. Mary's Medical Center in West Palm Beach, Florida. Considering that I work for one of the most powerful and largest for-profit healthcare companies in the United States, we need to have the power of 1199 behind us when we go into negotiations, and we have dealings to do with this company. So I'm more than happy to have the power behind me now.
Hi, I'm Betsy Marvel. I'm a nurse. I work at St. Mary's Medical Center in West Palm Beach. And I'm just thrilled about this. We now have voted to join 1199 United Healthcare East. And it's wonderful. We're going to be union. I'm from New Jersey originally. So we're going to be union the whole East Coast. It's going to give us more power and more voice at the work site. And we're really working toward eventually mandatory safe staffing in Florida. This is just going to help us and empower us to do that, and we can become a powerhouse down here and fight for quality health care for our patients and good working conditions for our nurses and healthcare workers.
Hi, I'm Pat Putman. I work at St. Pete General Hospital in the lab. This merger is going to give us resources, power. ability to organize more hospitals.
My name is Clarita Morgan. I work at Unity Health and Rehab Center in Miami, Florida. Well, this merger is going to impact me because we are already strong, of course, but this is going to make us stronger. It's going to cause us to have more members, a lot more members. I'm just looking for all the good changes that's going to come with it because I know that all we're doing is going higher and higher and getting better and better.
I am Janelle Manigault. I'm a LPN at an HCA facility. I am so excited about this merger with New York. So powerful and positive and been around for a long time, and I hope it brings some energy to where I'm working.
Are you ready?
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 Someone that has a negative vibe, and if you're trying to make it, they only push you aside. They really don't have nowhere to go. Ask them where they're going.